Meniscus surgery recovery timeline. Here's the key thing. Recovery after repair is very different from a simple trim or cleaning. If the meniscus is repaired, recovery is slower because the tissue needs time to heal. If a small part is removed, trimmed, walking and daily activity usually come back much faster. In the first 1 to 2 weeks, the focus is on swelling, pain control, and safe walking. After a trim, many patients can weight bear early. But after repair, it is a completely different story. You are on crutches with a brace and more restrictions. From weeks 2 to 6, we focus on regaining motion, quadricep strength, and a normal walking pattern. Driving is not just about time. It's when you're off from the strong medication and when you can safely control the car. After minor arthroscopy, it may be around 1 to 3 weeks, but after a repair, it usually takes longer. By 6 to 12 weeks, recovery starts to separate even more. After a trim, many patients are progressing toward high-level activity, and some return to sports in roughly 4 to 8 weeks, while unrestricted sport is closer 9 to 12 weeks in some cases. After a repair, this is usually still too early for full sport. After a meniscus repair, jogging often starts around 3 to 4 months, and full return to sport is usually closer to 6 months or even more, depending on the repair and the sports activities. The most common mistake is comparing your knee to someone else's knee. The right milestone is not just time, it's swelling, motion, strength, control, and whether the knee is actually ready or not.